Woken up feeling terrible. Your throat is scratchy. Your nose is stuffy. You feel like you've been hit by a truck, and all you want to do is crawl back under the covers and hide from the world. You just want to stay in bed all day. The thought of getting up and facing the day seems impossible. Every movement feels like a monumental effort. We've all been there. It's so common to catch a cold or the flu, especially during certain times of the year. The changing seasons, the colder weather, and being around more people can all contribute to feeling under the weather. But how do you know if it's just a cold or something more serious like the flu? The symptoms can be quite similar, but there are key differences that can help you determine what you're dealing with. Understanding the difference can help you feel better faster. Knowing whether you need rest, over-the-counter medication, or a visit to the doctor can make a big difference in your recovery. It can also help you prevent spreading germs to others. Simple actions like washing your hands frequently, wearing a mask, and covering your mouth when you sneeze can protect those around you. In this guide, we'll break down everything you need to know about colds and the flu. We'll provide you with the information you need to take care of yourself and your loved ones. We'll talk about symptoms, causes, and treatments. From the first signs of a scratchy throat to the full-blown symptoms of the flu, we'll cover it all. We'll also debunk some common myths. There's a lot of misinformation out there, and we want to make sure you have the facts. Let's get started. Colds and the flu share some similarities. Both are respiratory illnesses caused by viruses, but they have some key differences. Colds are generally milder than the flu. They usually cause a runny nose, sore throat, and congestion. The flu hits you harder and comes on quickly. It usually causes fever, chills, body aches, and fatigue. Here's a simple way to remember the difference. Cold, think head cold. Symptoms mostly affect your head and nose. Flu, think whole body. Symptoms affect your entire body, making you feel much sicker. Colds and the flu are caused by viruses. These are tiny invaders that can make us sick, and they're much smaller than bacteria. In fact, they are so small that they can only be seen with a powerful microscope. These viruses can invade our bodies and take over our cells, turning them into virus-making factories. And this is why we feel so terrible when we catch a cold or the flu. Viruses spread easily from person to person, especially in crowded places where people are in close contact with each other. This is why it's common to see outbreaks in schools, offices, and public transportation. Think about it like this. When someone sick coughs or sneezes, tiny droplets containing the virus fly into the air. These droplets can travel several feet and land on surfaces or be inhaled by people nearby. If you breathe in those droplets, you can get sick too. This is why it's important to cover your mouth and nose when you cough or sneeze, and to avoid close contact with people who are sick. You can also get sick by touching a surface with the virus on it. Viruses can survive on surfaces for several hours and sometimes even days, depending on the type of surface and environmental conditions. For example, if someone with a cold touches a doorknob and then you touch it, you could pick up the virus. If you then touch your face, especially your eyes, nose, or mouth, the virus can enter your body and make you sick. That's why it's so important to wash your hands frequently. Using soap and water for at least 20 seconds can help remove viruses from your hands. If soap and water are not available, using a hand sanitizer with at least 60% alcohol can also be effective. Additionally, wearing a mask and practicing social distancing can help reduce the spread of viruses. Masks can block respiratory droplets, and keeping a safe distance from others can minimize the chances of inhaling those droplets. Vaccination is another powerful tool in the fight against viruses. Vaccines can help your immune system recognize and fight off specific viruses, reducing your risk of getting sick. If you do get sick, it's important to rest, stay hydrated, and follow your healthcare provider's advice. Taking care of yourself can help you recover more quickly and prevent the spread of the virus to others. By understanding how viruses spread and taking steps to protect ourselves, we can reduce the impact of these tiny invaders on our health and well-being. Stay informed, stay safe, and take care of each other. Cold symptoms: runny nose, stuffy nose, sore throat, cough, sneezing, mild headache, low-grade fever sometimes. Flu symptoms: fever, usually high, chills, cough, sore throat, muscle aches, fatigue, feeling very tired, headache, runny or stuffy nose sometimes. Remember, everyone experiences illness differently. You might not have all of the symptoms listed. The good news is that there are simple things you can do to protect yourself from colds and the flu. These steps are easy to follow and can make a big difference in keeping you and your loved ones healthy. Prevention is key. Here are some tips. Wash your hands often. Hand washing is one of the most effective ways to prevent the spread of germs. Make it a habit to wash your hands regularly, especially before eating, after using the restroom, and when you come home from outside. Use soap and water for at least 20 seconds. This ensures that you remove any germs that might be on your hands. Sing the happy birthday song twice to make sure you're washing long enough. Use hand sanitizer if soap and water aren't available. Hand sanitizers can quickly reduce the number of germs on your hands in many situations. Make sure the sanitizer contains at least 60% alcohol. Use an alcohol-based hand sanitizer. Avoid close contact with people who are sick. This is especially important during flu season or when there is an outbreak of illness in your community. Stay away from people who are sick. If you are sick, stay home to prevent spreading illness to others. It's a simple but effective way to protect your community. Cover your coughs and sneezes. Use a tissue or your elbow, not your hands. This helps prevent the spread of germs to others and keeps your hands clean. Cough or sneeze into your elbow or a tissue, not your hands. Clean and disinfect surfaces regularly. Germs can live on surfaces for hours or even days, so it's important to keep them clean. Regularly wipe down frequently touched surfaces like doorknobs and phones. These are common places where germs can spread. Use disinfectant wipes or sprays to keep these areas clean. Get your flu shot. The flu shot is the best way to protect yourself from the flu. It helps your body build immunity to the virus and reduces the severity of symptoms if you do get sick. Make sure to get vaccinated every year, as flu strains can change. Section 6. Feel better. Fast treatment tips. Most of the time, colds and the flu can be treated at home. Here are some ways to feel better. Rest. Give your body time to recover. Stay hydrated. Drink plenty of fluids like water, broth, and herbal tea. Use a humidifier. This can help relieve congestion. Over-the-counter medications, pain relievers and decongestants can help ease symptoms. Remember to always follow the instructions on medication labels. Section 7. When to see the doctor? Most people with colds and the flu recover without any problems. However, sometimes it's important to see a doctor. Seek medical attention if you experience any of the following: difficulty breathing, chest pain, confusion, severe vomiting or diarrhea. High fever that doesn't go away with medication, symptoms that improve but then worsen. It's always better to be safe than sorry. Section 8, Mythbusters, Cold and Flu Edition. There are a lot of myths about colds and the flu. Let's debunk some common ones. Myth: you can catch a cold from going outside with wet hair. Fat colds are caused by viruses, not wet hair. Myth: antibiotics can cure colds and the flu. Fact: antibiotics only work against bacteria, not viruses. Myth: you don't need a flu shot every year. Fact: flu viruses change constantly, so you need a new flu shot every flu season for the best protection. Section 9. Take charge of your health. Colds and the flu are common illnesses, but that doesn't mean you have to suffer. By understanding the differences between these illnesses, practicing good hygiene, and following the tips in this guide, you can stay healthy and protect yourself and others. Remember, knowledge is power.